Health officials continue to maintain that home quarantine breaches, among other factors, are to be blamed for the rapid spread of the COVID-19 virus. Officials reported that over the holidays, the Health Ministry received an influx of applicants for home quarantine. Acting National Epidemiologist Dr. Dana Gomez stated that as the number of people who were supposed to be sequestered at home rose, so did the COVID-19 toll.
For November, so the blue is persons going to the hotel, the orange is persons on home quarantine, and the yellow is persons on facility quarantine. So for November, we see minimal persons going on home quarantine. In December, we have a larger number of persons going on home quarantine. So if we look at the cumulative incidence of COVID-19 cases and the cumulative arrivals on home quarantine, we can see that as there has been an increase in persons going on home quarantine, so have we had an increase in our cases as well. So we can draw some degree of correlation between the two.
Additionally, data suggests that the majority of cases come from areas with the largest number of home quarantine candidates.
We've been able to plot where we're seeing the majority of our cases, and also, so in the red is the incidence or the positive cases that we're seeing, and the green and the different shades would let us know exactly where the quarantine cases have been. So we notice that we have the greater density in areas where we are seeing that persons are going for quarantine. If you look up in the north, we see the greater density of individuals going on home quarantine, and also we see the greater density of cases being identified there. And you can see a couple of spots in the south with the density. If you notice the darker green, and the bigger circles are for the number of positive cases, hence drawing a correlation between the two.
The acting national epidemiologist revealed that the monitoring devices have sparked some concerns, but she is requesting public cooperation and patience with the health ministry as this is a new process.
Persons will be frustrated. We have been getting feedback from the ports of entry as to how frustrated persons can be, but it is a new process and we are trying our best to remedy the situation. So we ask persons to be patient, and we're also aware of some of the verbal abuse that the persons at the ports of entry, the staff at the ports of entry have encountered as a result of this. But we know persons can be frustrated. You come from a long flight, you may be tired, you may have children, but like I said, it's a new process, and we do ask and we implore the public to be patient with us as we try to roll out this.
People with no outward sign of sickness or persons with mild symptoms of the virus are prime candidates for home quarantine. Dr. Gomez continues to appeal to persons to remain in home quarantine until they are given the all-clear to resume normal activities. Gina Filippi, HCS News Force.